Welcome back to the news at 10. Since 1969, when Lassa fever was first seen in Borno State, northeast Nigeria, the 2012 outbreak of the disease has been described as the peak, with over 70 deaths. Health experts say if the ongoing outbreak of Lassa fever is not contained, the death toll could exceed the 2012 figures. Our correspondent Yomi Otaigwe reports.
Silently, this round of Lassa fever outbreak began in the month of August 2015 in Niger State, north-central Nigeria. Since then, close to 20 states have recorded cases of the disease, including Bauchi, Gombe, Taraba, Edo, Oyo, Ondo, and Lagos. One factor identified as a driving force for this present Lassa fever outbreak, which has recorded over 200 suspected cases in 62 local government areas and over 60 deaths, is the failure of disease identification and reporting framework.
In the next 3 months, we will at least activate 109 primary care facilities. The plan is that in this year alone, we should have 5,000 in place, and next year another 5,000. So if we have one per political ward, we will be able to trigger off a surveillance system that can feed into a national public health observatory, which will now work all the year round. Because what we have is a failure of a surveillance system. That someone died, we didn't report it, not another one, and we all assume death should be something to gloss over.
At an emergency National Council on Health (NCH) meeting on January 19, 2016 in Abuja, a Lassa fever eradication committee was inaugurated, and the NCH approved, among other measures, an increase in the number of diagnostic centers from 6 to 14. As it stands, the Irua Specialist Hospital in Edo State is about the only center dedicated to Lassa fever research in Nigeria.
Been making a case or made a case repeatedly for the establishment of centers of this nature in the other geopolitical zones in the country or health zones in the country.
Several states appear to have intensified public awareness on Lassa fever, an acute hemorrhagic disease transmitted to humans from contact with food or household items contaminated with excreta or urine of infected multi-mammit rats.
Let's take a deeper look at all this now. And joining me is the Commissioner for Health in Ogun State, Dr. Babatunde Ikpaye. Thank you so much for joining us on the news at 10 tonight.
Thank you. Good evening, Joma.
All right, so you're the Commissioner in Ogun. Yep. What exactly is the situation today in terms of infection? We know there are conflicting stories of what's happening in that state. So tell us what it is today.
Well, as of today, there are no confirmed cases of Lassa fever in Ogun State. However, I need to come to the public with what we are doing in Ogun State. Ogun State borders Lagos, and of course we are surrounded by many other states that already have reported confirmed cases. It's about the only state in southwest Nigeria that doesn't have a confirmed case, but we are dangerously exposed. There's no doubt about that. And 19 of the primary contacts, of course, to the first case in Lagos, the first case that was admitted at the Ahmadiyya Hospital in Ojokoro, 19 of the primary contacts are people who reside in Ogun State. And we've been following these 19 cases in the last 14 days.
So you confirm you have 19 contacts, not cases?
Not cases. And contacts are people who are exposed to an infected person, but they have not shown signs and symptoms. And so 4 of these contacts live in Ifo local government. Our surveillance officers have been monitoring them on a daily basis. We have given them thermometer. 14 of them live in Ota in Ogun State, and there's a case that lives in Abeokuta, actually a 24-year-old undergraduate of the Federal University of Agriculture, and I've even spoken to her today. So we're in close contact. We have given them thermometer. We are monitoring. I mean, as the expectation from our Department of Public Health. However, on Saturday, we had a 7-year-old boy that had fever and had bloody vomitors. And of course, we were alerted. We moved in. Our epidemiologist went to the General Hospital at Ijayi. We saw that the history was not consistent with Lassa. The boy was treated with anti-malaria and antibiotics. The boy had responded. He's been discharged. The young boy is playing around in his family house at Agoika. However, it's also our duty to also continue to keep an eye on him. And just yesterday, we had another case, and this is what active surveillance will do. Because when you mount an active surveillance, what it does is that it brings virtually anybody that is suspected to your attention. Now that's what we have done. And in Ogun State, we have even gone ahead to set up 2 centers.
Okay, I was going to ask you about that because most of the public healthcare professionals we've spoken to have talked about failure of the surveillance system, with Lagos being so close and other bordering states having had it. Is it just you doing that in your state, or is there any collaboration between Ogun and Lagos? Because even if all is well within, you still have people moving interstate. So what are you doing on that level?
The collaboration between us and Lagos was actually what led to us identifying the first 90 cases. It is the collaboration between the epidemiologist and the Director of Public Health in Ogun State and my office, working directly with our counterparts in Lagos, that brought that to our attention. Of course, because the hospital is not situated in Ogun State, it's in Lagos. But we got all the information of the contact from the hospital records. Okay. Then beyond that, what we have done is to also, on our own, invite the surveillance officers in the 20 local government of the state. And then we gave all the necessary, instruction, support, and directive, and input to make sure be on the lookout for cases. And like I was saying, because of that in Shagamu, we also were called because we have shared the hotlines, for Lassa response. We have, my telephone number, the telephone number of the state epidemiologist, everybody. We have communicated to the general public, and then people can call us for anything. It is our duty to respond immediately and make sure that we're able to provide the technical support.
All right, Commissioner for Health in Ogun State, Dr. Babatunde Ipaye, thank you so much for sharing your thoughts on the news at 10 tonight.
Thank you, Joma.
And from health, we're going to switch over to business news. Here's Anne Waudu.